Hello everyone, Dr. EvanLevine. We're going to talk about hypertension today. Now we know that hypertension increases the risk of coronary artery disease, stroke, heart failure, and even atrial fibrillation. That's how important it is to control your blood pressure. And today quickly we're going to talk about two reasons why the doctor's office may not be the best place for you to have your blood pressure checked. One is called white coat hypertension. Now what is that? Well, it's named because most providers and doctors wear white coats. And you go into the office and your blood pressure can be artificially elevated. You're very nervous. You're anxious. Maybe you've been waiting in the office too long. Maybe it has nothing to do with the white coat. But 30% of patients, when they go to the doctor's office, their blood pressure is artificially elevated. Because the doctor's not wearing a cool shirt like this. So you might think your blood pressure is elevated at the doctor, but when you go home, it's low, and you could get too much medication, and your blood pressure might be too low, and you could fall down. This is incredibly important for seniors who have a higher risk of falling down. The second thing we're going to talk about is something less known, but equally as important, called masked, like wearing a mask, hypertension. And 10% of people have this. And what happens is you go to the doctor's office, and you think you might have white coat hypertension, so you chill out really well. And for that brief moment when they take your blood pressure, it's lower than normal. The doctor and you think your blood pressure is normal, but for most of the day it's elevated, and you're not treated. And this, of course, increases your risk of the things we spoke about: coronary disease, stroke, congestive heart failure, and atrial fibrillation. Those are the tips for the day. If you have any other further questions, please give me a call.